It's 11 a.m. in Seoul. I'm Kim Mo-gyun at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Director of Health Policy Yoon Tae-ho will be briefing us today on the coronavirus situation here in South Korea. He will fill us in on the number of new infection cases and what kind of efforts the government is making to contain the virus, especially with the spurt of cluster infection cases seen in recent days. We're still waiting for the briefing. And before that, I'll just give you a short wrap-up of the latest developments. There have been 267 cases have been reported as of Wednesday, and the briefing will start right now. Let's take a listen.
First of all, Vice Health Minister Kim Gang-nip will explain. Let us now begin our regular briefing for September 2nd, Wednesday. As of today midnight, we have 253 new local infections. Yesterday, we had 2 additional fatalities, and so far the death toll stands at 326. I extend my deepest condolences to the deceased and the members of the bereaved families. In the metropolitan region, we had an on-day increase of 187, and for this 3 straight days, we have the increase in the 100s. However, we believe that more than 3/4 of the on-day increase nationwide is clustered in the metropolitan area, and we have a continued outbreak here at the metropolitan area. And we also had great worries about a large surge in the number of cases. However, we are seeing a continued slight decrease in the number of on-day increase. However, we are still witnessing cluster infections at various venues nationwide, and the trend of decline is not very steep. And this is not a state for us to stay and to let our guards down yet. And in order to flatten the curve going forward, and in order to return and regain our capacity of quarantine control, we believe that the only effective measure we have at hand is practicing social distancing. We understand that this causes great inconvenience to many public. However, we once again highlight the fact that you need to participate in social distancing. Today, the number of patients with severe or critical conditions amounted to 124. Among them, those with critical conditions is steadily increasing. And as for these people who are in need of intensified treatment amount to about 40. And among the latest increase in the number of patients, we have above 40% of the total which are above the age of 60. And therefore, we believe that such number will continue to increase going forward. And we will collaborate with the private circles as well as the public circle to secure more hospital beds. And during until the end of this month, we will also additionally secure 110 hospital beds for the intensive care units. And we will also turn the hospitals, some hospitals, into a designated hospital to treat severe or critical conditions. And we will secure more hospital beds going forward. And as for these designated hospitals, we will provide great level of compensation and provide sufficient amount of incentive so that we can proactively secure the amount of beds for these patients with severe or critical conditions. We will also mobilize the personnel from the military as well as the Ministry of National Defense, and we will also mobilize more nurses, and we will also mobilize more supplies like ECMO and other equipments so that we do not have a medical gap in treating these patients with severe or critical conditions. Next, we are seeing and we are preparing for a possible widespread outbreak nationwide, and we will make sure that each of the regions have no issues in treating the patients with severe or critical conditions. We will have by region designated hospitals for supervising the number of hospital beds in those specific areas, and centering around these hospitals, we will be monitoring the number of hospital beds available for use by the patients with severe or critical conditions so that we can have an efficient use of the hospital beds going forward. And in order to secure more beds, we will also provide a total of 140 billion Korean won for the hospitals nationwide, and we will also continuously steadily increase the number of hospital beds available for the severe or critical conditions, and we will additionally secure 469 more beds, and currently we have about 500 beds available, and we will have another 500 available to treat these patients with severe or critical conditions. Life treatment centers will also cooperate with the private and public sectors, and we will also increase the number of rooms available. Yesterday, we opened new additional centers nationwide, and now we have about 13 services, 13 facilities, and we have about 1,300 rooms available, and also 1,600 rooms available right now. And we will also secure additional facilities and secure about 1,500 more rooms. And also, to prepare for the worst case scenario, we will also have the supplementary facilities of 9, and we will also make sure that the life treatment centers will be able to house about 7,800 patients going forward. And there are many private sectors, many private companies, as well as those public organizations that are participating in our cooperation to secure more life treatment centers. Thank you very much for that. And as for the life treatment centers, there were some breaches of self-isolation. And so far, the police has investigated about 1,700 cases of these breaches, and about 700 of them are under investigation right now. And some of them also have faced criminal charges, and there were also some breaches of the self-quarantine, and also these areas that are deemed as grave violations. We also have the police administering them as the criminal charges. And as for the breaches of wearing a face mask on public transportation, about 300 cases have been investigated, and we still have dozens of cases under investigation. And these are the major breaches against the life treatment centers, and they have been designated to each of the branches of police depending on the graveness of their conditions, and about 9 people have been also arrested so far. And as for the spreading of false rumors and fake rumors, we would like to note that these goes against the efforts made by the quarantine officials, and we will also have these measures be met with stern responses going forward. Today and tomorrow, we will be under the influence of the 9th typhoon of the season, Maysak, and we will also be under great wind and heavy rainfall. And therefore, we need to be fully equipped with our supplies in relation to COVID-19. And we would also like to ask the public to minimize the damages, and please refrain from making outdoor travels. And we also have greater concerns on the increase of the indoor activities, and please note that wearing a face mask is essential. And today marks the 4th day of the intensified social distancing measures in the metropolitan area. Until the end of this week, the public and the government must cooperate fully to intensify our quarantine measures and carry out these measures stringently. And as for the residents living in the metropolitan area, please stay home as much as possible and postpone and cancel all of your social outings and travel plans. We believe that the efforts that are placed today will determine the future of the outbreak, and please take particular precaution. And please stay united in fighting the COVID-19 so that we can wisely overcome the outbreak, and the government will also exert our full efforts to this end. As for the collective action carried out by the medical practitioners, today marks the 13th day, and this is causing great concerns and worries by the public. And the government has unconditionally stated that we will halt our plans, and we will also engage in our dialogue with the medical circles once the COVID-19 situation is stabilized. We also talked with the senior members of the medical circles, and they have also cooperated and engaged in dialogue with the government officials as well as the National Assembly, and the ruling party as well as the lawmakers have expressed intentions to also engage in candid dialogue going forward. So we ask the medical practitioners to return to their duties and having great trust in the pledges made by the government, the National Assembly, and their seniors. And the later they return to work, the more the pain needs to be endured by patients. So we once again urge them to return to their duty as soon as possible. Thank you very much.
That was the daily briefing on the COVID-19 situation here in South Korea by Kim Gang-nip, the coordinator of the Central Disaster and Safety Countermeasure Headquarters. We just heard that there were 267 additional infection cases of COVID-19, bringing the total to 20,449. There were 2 additional deaths, raising the death toll to 326. That wraps up our coverage of this morning's briefing. We'll be back with our regular newscast at 12 p.m. Korea time. Bye for now.